Hello and welcome to Softline. I am Nancy Banigo, and as always, I have my co-host with me, Eddie Young. Ian. She was waiting for the rolling of the drum. All right. Eddie, how are you?
Hello, everyone. It's nice to have you on our Thursday edition of Softline on ADBN TV. And guess what? We're coming your way with an interesting topic, as usual. It's always my pleasure, remember, to be on set, to see you, know that you are also there watching me, and that you learn a lot. Remember, you make me look forward to always being here. So, Nancy, how are you today?
Seriously, Eddie?
Yeah.
The way you said it, that was why I stopped. I said I want to stop rolling this drum for you because you have personalized it. I mean, you say, make me want to come here.
I don't know.
Every
Okay,
day. It's supposed to be make us want
make
to.
us.
It's supposed to be a collective effort between us. But you said me. You.
Okay, so now are you also saying you like coming here because of your people, or you're doing it because of the job?
No, this is soft line.
This is soft line.
Yes,
okay,
and
so
both of us soft line.
Okay, let's not bring our quarrel on air.
You know, that brings me to what I asked you earlier.
Yeah.
You know, talking about Women History Month March, as we are, we've had so many celebrations, so many organizations gathering because of women. You know, it begins to make me think, to what end? Is there really any progress being made? Each year we celebrate women like 4 or 5 times in a year. If you ask me, we have 4 or 5 times in a year where we celebrate women in a big way. But to what end? As a woman, do you think we are making progress when you come to women gathering? What do you see?
Oh, well, I think the gathering brings out, it tries to sharpen the women, tries to mold them up, tries to drive in a message towards what is expected of women. We may not have achieved completely or in totality what is expected. That's to say, having women, supporting women. We may not have experienced it in totality, but I must say that there are some societies, some environments where it's being achieved and it's being appreciated. And so I think the yearly, the annual coming together, drumming this message would raise, keep raising the sensitization. But for me, what actually crossed my mind was that I think for some years there could be a repeat of the theme rather than moving to a new theme. You know, for this year is Inspire Inclusion. Last year was was it last year or last 2 years was breaking barriers. And so I feel there should be an appraisal, at the end of the year to see if this theme was met. And then if not, it could be sustained. Yeah, we keep drumming it rather than keep having a new theme. So when that's achieved, then we could now move on to. But then at this point, I think this is regulated at the international body and being sent. So.
Yeah, but then our opinion also matters. You know, you don't know who is listening. So, like Inspire Inclusion, I think it's something that should run for a while. Even though women have made progress when you come to some field, talking about banking sector in Nigeria, you understand, we have a lot of women who are regional head, who are heading so many banks, and it's a good thing because we never had such a thing in the past. But when it comes to politics, that is where we still have the problem, and that is why I'm asking, all this gathering, to what effect? Because when a woman comes out to contest for a position, sometimes it's the women who undo her, or how do I put it? It is the women who don't come out to vote for her. You see most of the women going to vote for a male. When we have a male and a female contestant, and sometimes when you ask them, they tell you they don't believe a woman can do it.
I don't think so.
Yeah, I tell you, I have seen a woman say so. So when we have gatherings like this, isn't it supposed to make us feel or know that we can actually do it and we can actually believe in ourselves as women? So why would a woman come out and then say, no, I can't vote for a woman because I don't think she can do it? When she's supposed to be having time with her family, how will she come out to work for us? Let's leave it for the man. And then she goes off.
But you'll never have 100% total support. It's always the case. There'll always be a fraction that won't believe in you, even for the men folk. And you know, for me, the worst part of it is when you're indecisive. You're neither here nor there. That's the worst one for me.
Sitting on the fence.
Yeah. So so it's even better you say you're not supporting or you're supporting than being neither here nor there. Yeah, so I believe we'll keep drumming, we'll keep pushing forward. And one day, talking about the political, women are trying. At least when we say breaking barriers or the inclusion thing, initially it was very difficult to even find a woman in the political area. So I think there is inclusion gradually. And sometimes we women need to be alive to our responsibilities so that we don't get messed up. Because some of us, during the lecture, a certain body in Nawood had their International Women's Day, and someone gave an address and said, when you are being appointed, make sure you finish well. Don't, by your appointment or whatever responsibility you are given, close the door for another person. You know, make sure that you rather open doors, you finish well so that you could be referenced. If you leave a bad record, next time, when they want to consider a woman, they would say, the last one, what did she do? So whenever you have the opportunity to serve, please do it with all diligence
and sincerity.
So that another woman could stand a chance. So gradually, for me, let's keep moving. We will one day break that barrier. Sometimes those who are analytical would look down. Some of those people, they don't support if it's an elective position during politics. If you actually study the history and look at the antecedents, you know that you don't need to go in and fail, but rather just move on. And then,
you know, it just reminded me of, I listened to a doctor, you know, speak yesterday on one program, one of the sister stations, and she was like, you know, when I came down to Nigeria, I'm just quoting her, she said, when I came down to Nigeria, I was doing so well. You know, I helped a lot of women, and I discovered women were excluded when it comes to decision making in the state, and so women were not being helped when you talk about health, you know, health insurance and all that. So I felt there was so much to be done in the state, and so I was talking to a lot of women. And so some women said, okay, why not just come out and contest for governorship election? And so, you know, when I look at these women giving me this morale to come out and contest, I have this feeling that I am going to make it, of course, with the, you know, the population of women. When I have this population of women behind me, nothing can stop me. But lo and behold, on the day of the elections, she didn't even get up to 10 votes. So you begin to wonder what happened at the end of the day. Anyway, let's go on a very short break. And when we come back, we shall introduce our guest as well as our topic. Stay with us. We'll be right back.
In a world of overwhelming voices, where everyone has different opinion on different issues, it is important that we bring the core issue to the fore. Join me, Nancy Banigo, on Softline as we lend our voices to inform and influence your thoughts and actions. This is not just mere talk, it is an invocative program that touches the core of our existence.
Life is a combination of colors and experience in its beauty. The Lifestyle Gallery showcases the beautiful blends of African lifestyle, a TV magazine of lifestyle, food, homes, and fashion, combined with interesting interviews on trending issues. I am Nana Abena. Welcome to my world. Join me every Saturday at 2 p.m. and a repeat on Sunday.
Welcome to the rule of the majority, a government in which the supreme power is vested in the people and supervised through a system of representation. Democracy belongs to the people. Political Trail follows these developments and many more. Political Trail, trailing political developments.
In a world of overwhelming voices where everyone has different opinion on different issues, it is important that we bring the core issue to the fore. Join me, Nancy Banigo, on Softline as we lend our voices to inform and influence your thoughts and actions. This is not just mere talk, it is an invocative program that touches the core of our existence.
Been that. So last week was World Oral Health Day, and we started discussing it on the show, but we felt we didn't do justice to that topic. There were lots of questions to be asked. I could see it on Eddie's face, and I also had so many questions to ask the doctors, the dentists that were on the show. So today we decided to bring back our dentists to come and answer some of those questions that we really want to know. All right, so we have back on the studio today Dr. Sylvester Ombode. He's a consultant family dentist with the dental department, University of Uyo Teaching Hospital. Doctor, you're welcome back to the show.
Thank you very much. It's a pleasure to be with you once again.
All right, so doctor, we started last week, and one thing I took back home that kept ringing on my head was when you said your mouth is like the mirror of your body. I begin to wonder, when you say the mouth is the mirror, and I remember the other doctor saying, looking at your mouth, he will be able to tell the state of your health and all that.
Yeah.
So, you know, when I go back home, I was like, it's better I keep this mouth clean so that, you know, keeping my health and all that. But today I want us to delve into the aspect of cosmetics.
Okay.
You know, talking about what they call it,
braces and all of
veneer and all that. What are they? Let's just start from there.
Thank you very much. Like we said last week, the mouth is not just for eating, neither is it just for talking. The other functions of the mouth, and one of the main functions of the mouth is beauty, actually the teeth. You see somebody that just smile and say, wow, such beautiful set of teeth.
I tell you.
Whether you like it or not, when you talk to somebody, the first person notices about you is your set of teeth. You can't hide it. Whether a person is a dentist or not. Why? Because it adds to your beauty. So there are various aspects when it comes to aesthetics. When we talk about cosmetic, that means about aesthetics. Aesthetics is about beauty.
Beauty.
Various aspects of aesthetics. One, the arrangement of your teeth. Are they well arranged? Are they where they're supposed to be? Okay. When it comes to arrangement of teeth, we start talking about this called malocclusion. Malocclusion is a derangement in normal occlusion.
Okay.
Yes.
So what is the normal
occlusion?
Okay. Well, in dentistry, we say normal is just an ideal. Ideal in the sense that it's not actual.
Okay.
So without how we will call malocclusion, the class 1 malocclusion, which is acceptable. Class 1 malocclusion is acceptable where you have a proper relationship between what? The molar relationship, where the upper molar, the mesial cups, because the molars, the crown has what we call cups. Okay. Those ones used to bite, those ones used to chew. Okay. They are cups. So tell you that where the mesiobuccal cups of the upper first molar bite on the buccal groove of the lower first molar, you see, then the canine, upper canine, is biting between the lower canine and the lateral, that is the lateral incisors. Okay. So when is that, we call it a class 1 malocclusion, which is the acceptable kind of malocclusion. Okay. But there are other classes. We have the class 2, we have the class 3. Class 2 is called pre-normal. Class 3 is post-normal. Okay. So you see a class 3 malocclusion, instead of the upper set of teeth to bite outside the lower one, it bites at the reverse side, what we call reverse overjet.
Oh, okay. Okay.
I must have seen a number of people
Yeah,
kind of
I
this
think
thing.
that occurs when some people suck their...
No, that's another this thing. There's a reverse.
Okay.
And that reverse can be as a result of the arrangement, the formation of the jaw.
Oh.
Okay? Then the class 2, it will bite normally in front of the lower, but there's a wide disparity.
Okay.
Okay? So, but there are various causes of malocclusion.
Okay.
Like you just said, there are habitual causes, which is the commonest. Those that suck their thumb, children that suck their tongue, those that suck their lips. Okay? Once somebody sucks the thumb or the tongue, you find out that the upper and the lower teeth don't come together.
Okay.
Because the tongue or the thumb is permanently there, so there's what we call an arterial opobite.
Okay.
So people say the person is permanently smiling. And it can be corrected.
Okay.
Okay? Such people cannot bite pure water. They find it very difficult to make some sounds that will require their teeth, like consonant sound cannot be made by them. Air will be escaping. Then we have other kinds of malocclusion where the teeth are not properly arranged. And this one is common during the formative stage. That's why I always tell parents, when you see your child having habits, tongue sucking, top sucking, seek for attention, because those habits can be broken.
Okay. They are quite difficult to break if you ask.
No, we can't be broken. They can't be broken. It just requires some professional touch.
Oh.
Oh, yes. You can counsel the children to break it.
Okay.
Why the children can, once they realize that, look, this thing is not correct and it can be broken, they can break it themselves.
Okay.
All right, so with all these explanations you've given now, do they correct themselves naturally? Or they still have to pass through the...
Yes, let's come back to... These things can correct themselves naturally if the parents or the individual seek attention or time. Like I said, when the teeth are not properly arranged, for example, if the child is changing the teeth from the milk teeth to the permanent teeth, there's a natural process. The milk teeth have to fall off for the permanent to come in. Well, you discover that of recent, not quite too long from before now, you find that some children will have their permanent teeth growing behind their milk tooth. And the parents don't know that, look, it's not normal. They will just say, well, don't worry, mine fell off after some time, the tooth will fall off after some time, and that tooth will now grow up and take a permanent position while the milk tooth is still in place. When that happens, the child will have what we call double teeth. Or if that milk tooth virtually falls off, that permanent tooth has taken an abnormal position. Okay? But for parents that are educated, that are medically aware, once they notice they get to a dentist, just take out the milk tooth, the permanent tooth will naturally move to its rightful position. Okay? Then there are other conditions where when a child is changing the tooth from milk to permanent, there's a stage we call the mixed dentition stage.
Okay.
Okay? Where you still have some milk teeth and some permanent teeth.
Okay.
Okay? At that stage, all the child needs is what we call preventive orthodontics. Just see a dentist who is able to guide the parents on what it looks like. For example, when the child has the milk teeth, some of the milk teeth like the deciduous molar still in the mouth, and the anterior teeth, which are the incisors, already out permanent, you found that the canine, okay, the adult canine that is still within the bone is trying to find its way out. But look at what happens. In the process of trying to find its way into the mouth, it uses the permanent lateral incisors as a guide. Because that is the tooth directly next to it. You use it as a guide to erupt into what? The mouth. So any attempt to disrupt that process that canine either get impacted or will come out at the wrong position. So at this stage, parents come to this stage and they are worried. I don't like the way my child's teeth are looking. Doctor, I want to give him or her braces. And I will smile. And I will say, well, at this stage, we call it the misdentition stage. One of the commonest things is what we call the ugly duckling stage. You know, ugly. You know when you see a duck, these things are scattered. Okay, that will happen. Because the canine is trying to find its way into the mouth, so it puts pressure on the lateral incisors until we deviate and have this ugly ducking presentation. But once the canine erupts into the mouth, that it corrects itself. I've had parents come with all kind of complaints. They want something done. I will smile. I say, if you want us to take your money, they will just take your money and tell allow it to follow its natural process. Okay. So what they say is just counseling. You see the dentist regularly counsels the child and monitor the eruption. And after that, the whole thing will return to normal.
What age?
From age 6, 7.
Oh.
Yes. Age 6
but
or
if
7.
this presents itself for a child who is about 10 to 14,
yes,
that is when the braces is required.
That is when the braces is required. You now need what we call an intervention.
Okay.
You need an intervention. There are 3 stages of this. You have what we call the preventive stage, where you prevent the malocclusion from happening. You are not doing anything, only monitoring. Then you have what we call the interceptive stage. That's when you see that, okay, this milk tooth is supposed to be out, but it's still in place. So you take it outside, a permanent can go. Then when this all fails and there's a residual malocclusion, then you go to the final stage, which is called what? Intervention. When a child will not have to wear braces, either a child is wearing the fixed braces or is wearing the removable orthodontic appliance, or is wearing a habit breaker. Habit breakers are those things that break the habit, like those that have tongue sucking, lip sucking. For a lip sucking, we'll give a lip bumper to prevent the child from sucking the lip. For tongue sucking, we put what we call a tongue rake, so that the hand will not find a comfortable position, either a tongue rake or a goal post, which can be fixed or removable. Naturally, when some of those habits are broken, the malocclusion corrects itself.
Okay, so how about the ages to which this can be related?
Yes.
So that you know that at a certain age, this is what to expect, and if it's beyond that age, then you need attention.
The preventive stage, I said, is the early stage, around from age 6. I discovered that a child is still thumb sucking. You must see a dentist. That will not require intervention, but just require counseling and some other preventive measures. Okay, when that is not successful, you now give the child what? A habit breaker. At that early stage, between 6, 7, and 8. Okay? After age 10, whatever habit is there has to be broken by what? An intervention. You give a fixed habit breaker so that the child will not be able to find a comfortable place in the mouth to suck or tongue thrust.
All right, so that is for the bracelets. Now let's talk about this veneer, because I didn't know much about it until yesterday. So when you see people with so much white teeth, because that's the trending thing now, everybody wants to have this white teeth, you know. So I now discovered that, so you can even paste as in a white, kind of like you're fixing a nail, right?
Exactly.
Okay, so how common is it? Because I'm just discovering it. So
it's very common these days because the Chinese people are doing wonders. Actually, it's a Chinese technology.
Serious.
We have what we call veneers in dentistry generally.
Okay.
And these ones are like, if you have a discolored tooth, you can put a permanent veneer on the tooth. We cement it on it. Okay? But somehow, some years back, China now came up with this technology. The same way you buy this set of nail extension. You just buy a veneer. It comes in a pack, and you slip it into. This is not a veneer. This actually this.
A bracelet? No,
no,
not even a bracelet.
This is a retainer.
Okay.
This Axis retainer.
Okay.
So they have this veneer. They just slip them in, like the way you put your nail. Put it individually on this. They look very beautiful.
Wow.
White.
Now,
this is Chinese technology.
Now the problem with this veneer is how do you take them off?
Just clip them off. The way you take off your nails.
The fixed.
The fake ones.
Yeah.
But we'll have the real veneers.
Oh. Oh, okay.
This one you see people put are actually the fake veneers.
Okay.
There's a Chinese technology. Like see where they are putting them down.
Okay.
Okay.
Yeah.
You have the real veneers that when we fix them, they are permanently fixed.
Seriously, I mean, is that not going to cause problem for
no. Yeah, I was about asking, what's the advantage or the advantage we know is for beauty and all of that, but the disadvantage
for beauty, of the real veneers, they came into being when we have patients that have discolored teeth that cannot be whitened.
Okay.
I was saying last time we have what we call tetracycline stain for children that comes to before the age of 11. Okay. Some tetracycline stains are very deep, severe type. We also have some stains like the amelogenesis imperfecta, the tenogenesis imperfecta. These are permanent. No matter how you bleach them, you can't take them off. So for such people, we give them what? Either we give them a veneer, a 3/4 crown, or a full crown, depending on the severity.
Okay.
So for veneer, we have the zirconia veneer. That's all ceramic veneers. You just prepare a tooth and slip them in, cement them permanently, and they'll be there for life. No effect, no problem, no discoloration, so and they are beautiful.
During brushing, it doesn't wear out.
You just brush the veneer.
You brush normally.
Not your regular tooth. How about gathering dirt and all that inside?
No, it's just like your normal teeth. Like these ones now, you can see, these ones so you see now are veneers, are the permanent veneers.
Oh, okay.
I get it now. Permanent veneers. You can see, they will just cement them into
the tooth.
Yes, onto the tooth, and they are permanently there.
You eat with it, do everything.
You brush with it, eat with it, everything, like a natural teeth.
So is that not better than having the natural teeth? Because I remember when we talked in the last episode, you said too much brushing washes off the enamel and makes it turn yellowish.
Yes, but it's not cheap.
Exactly. I was coming to that. I was coming to that because we know the cost of dental health is not. It doesn't come cheap.
Zirconia veneer, each is about 150,000 naira.
Okay, so like a
if you are doing
32 teeth.
No, you can't do 32.
Why not? Why?
No, veneer for your posterior is not necessary.
Okay. You just need the smiling.
You just need the smiling. You just imagine doing 8 up, 8 down.
At 150.
That is 16. That is 16 times 150. That is the average. Some go as far as 200, depending on the way you're doing it. If it's Lagos, you can pay as far as 200.
Okay, so how about the other one, not this permanent one, the one you can just slip?
The Chinese thing is cheap. You can buy a pack for less than 20,000 naira, depending on where you're buying it.
Okay, interesting. so doctor, before I forget, what happens to the process where milk teeth has a way of being very beautiful
and white.
But at the point of falling out and the permanent growing, the shape of the permanent sometimes can be so big and you're wondering. And then some takes time to come out. In fact, the dentition isn't the same anymore at the permanent stage. But at that milk stage, it's lovely. So what causes that?
That's what I say. Let's get back to the foundation. The milk teeth, they are smaller, whiter. They look beautiful because they were made for a small face.
The baby face.
It matches the face. The permanent teeth are larger because they are made for adulthood.
They are preparing you for adulthood.
Preparing you for adulthood. Okay?
Okay.
So you see a large central incisors. Some parents come and say the teeth are too large. I said they are not for now. They are for the future. The child is preparing for what? Their future.
Oh, Okay.
So based on the size of the face, they look large. But based on the adult face later in life, they'll be normal.
It will now become normal. All right, doctor, we'll have to go on a very short break. When we'll come back, we'll continue with this conversation. Stay with us. We'll be right back.
In a world of overwhelming voices where everyone has different opinion on different issues, it is important that we bring the core issue to the fore. Join me, Nancy Banigo, on Softline as we lend our voices to inform and influence your thoughts and actions. This is not just mere talk, it is an invocative program that touches the core of our existence.
ADBN, Advocate Broadcasting Network. ADBN, Advocate Broadcasting Network.
All right, so thank you for being there. We're still discussing oral health, and we have the doctor here in the house. So you're talking about trauma. You know, when you mentioned that trauma, I remembered because I have this crooked tooth here. This crooked tooth has been with me since my secondary school, and it happened because of a bell. My classmate was trying to ring a bell, and then I was behind him. You know, the thing just went up like this, and it was on my mouth. So there was a broken tooth, there was a shifted tooth, and all that. And so after crying for that pain and everything, my headmistress then, they just gave me some pain reliever, and that was all. Nobody mentioned, I didn't even bother to like worry about, I had pains even after that day, but I didn't make a big deal out of it. And that was how I grew up with this crooked teeth. So we're talking about trauma to the teeth. I mean, this is one trauma I have lived with for so many years. And then, is there something I can do to rectify? Because I've been scared to go see a dentist. I really don't like. So let's talk about traumas.
Yeah, trauma. One of the commonest things, apart from dental caries, tooth decay, the next most common this thing is what we call dental trauma. Dental trauma has become so common with the advent of technology.
Okay.
You know, those days your floor is just cemented floor. You have your phone with, if your parents have some money, they put carpet. Either the rubber carpet or the rug on it. So if a child falls on a rubber carpet or a rug,
it's not so traumatic.
It's not so traumatic. But with the advent of tiles, we have a lot of patients now coming to the hospital with trauma. One, those tiles, well, we have tiles, but we don't know what goes along with tiles. Because if you must have tiles in your room, must have bedrooms, you must have sleepers that are compatible with tiles.
Okay.
So a child will not fall easily. For the adult, they can break their fall. You at least find adults who will fall and have a fractured tooth or a crooked tooth. But for children, it's difficult for them to break their fall. So today we have a lot of children coming to the clinic with what? Fracture. I'm sure you've seen a child with either half front tooth or an adult with a discolored front tooth.
Yeah,
those are all product of trauma. Okay? If it's discolored, it can be remedied for an adult. You can do a root canal treatment, do bleaching, tooth whitening, or you put a crown on it, or put a veneer on it, as you said. But when it is fractured for a child or for an adult, it can be filled, either filled with composite or a crown is placed on it, excuse me.
Okay.
But the one that is very painful is, and we will have to talk about it, is when somebody falls down and the tooth pulls out from the socket hole. What we call aversion. As the tooth pulls out, somebody just pick it and throw it away. No.
What do they do?
Oh, beautiful. Pick the tooth by the crown, go to a running tap, and run water over it. close your eyes and push it back to the socket.
Wow.
Will it stay?
Push back to the socket, get to a dentist, and they will fix it. Within the first 60 minutes, that's the golden hour, that tooth will have about 90% success rates of being retained.
Wow.
Information.
Within within the next 6 hours, it has about 60% of being retained. But you see, if the person is not bold enough to push it in, just wash it in water and put it underneath the tongue.
Oh.
Okay.
And look for a dentist.
Straight to the dentist.
Yes, and fix it back.
Okay, that looks more realistic.
If that is not possible, rinse it under the water, put it in a small container and put milk.
Milk?
Yes.
Why milk?
Will also help preserve it.
Oh.
Or if the mother is there, you can put breast milk on it and look for a dentist.
Okay.
The worst scenario, just put it in water.
But these things you are talking about can only happen to a child. How about an adult?
Adults.
Oh, even an adult?
Even an adult. I had a patient one time, a full-grown man who went for a party somewhere in town and had a fight, and the tooth came out. First thing in the morning was in my house with the tooth in his hand. So we just washed it under a running tap, and I put it back. Took him to the clinic and splitted the tooth. Splitted it for about 4 weeks, and the tooth survived.
Wow.
So when a tooth comes off, please don't throw it away. Just look for a way of preserving it and get to a dentist. If you can see a dentist within the first 60 minutes, that is a golden hour. Or the worst scenario, within the first 6 hours.
All right. We've talked intensively on beauties, the veneer, the braces, and all that. Now let's deviate a little. You want to add something?
No, yeah, you know, because I think that explains it. When they have thrown away the tooth, that's where, and it cannot be replaced.
It cannot be replaced.
Okay,
yes.
They do a cosmetic.
Yes.
On it. Okay.
When you have thrown it away, you now have the option of either using a denture, removable partial denture, or using a fixed partial denture, that is a bridge, or you now go for what we call the most recent one, an implant.
Okay.
Okay, so talking about the crooked one.
Yeah, if it's crooked, just wear braces, can be rearranged.
And I hear the braces is painful.
Brace is not painful. It's a painless procedure. It's only painful to the pocket.
Okay, so how expensive is it to wear
to use braces? Depending on where you are doing it, as low as 550,000.
550,000.
Yeah, as high as 2.5 million.
To do braces.
Oh yeah.
Oh, my teeth is beautiful. I love my dentition. I can use it.
So those things you see on the screen there.
Oh my goodness. All right, so let's talk about mouth odor now.
Yeah, okay.
Because we have very few minutes. You know, there's this complaint people usually give that even after brushing, washing the mouth, few hours after, they get this offensive odor coming from the mouth. What is actually the cause of it?
Yeah. Well, mouth odor, scientifically known as halitosis. Halitosis is more of a social problem than pathological.
Okay.
What I mean pathological, most people that have mouth odor, in quote, except you are told, you don't know about it. So if somebody walks up to my clinic and says, "Doctor, I have mouth odor," the first question I ask, how do you know?
Who told you?
You see, I can perceive myself. I say it's not possible.
Really?
Oh, yes.
But you can do like this now.
When you wake up in the morning and you didn't brush at night.
You can do like this and you can
exactly.
Like this,
breathe into your hand and the air.
No matter how clean your teeth is, if you do that yourself, you'll perceive some mouth odor. The truth of the matter is that just like perfume, a perfume you use for regularly, you don't perceive it, true of us.
Yeah, at some point you're used to
you get used to it. It's called olfactory fatigue. Except your friend passes by and says, "Oh, you smell nice. Oh, can you perceive it?" Why do you ask that? Because you can no longer perceive, because you are used to it. Okay? An odor you are exposed to every day very soon you get used to it. You get what we call a fatigue, olfactory fatigue. Okay? So most people that have mouth odor on their own don't even know they have it. So when people come to class and say, I have mouth, how do you know? You say, I can perceive it. It's not true.
So, but if they say someone told
me. Exactly. Somebody told me. I get it now. A friend just told me in confidence that I should see a dentist that have mouth odor. Then we can start looking for it.
Okay.
And then that's number one. Number two, when people come like that, I say they have mouth odor. I say, how do you know? You say, well, I just perceive. I say, okay, do me a favor. I can't perceive it. Who is the closest person to you? Say, some people. I've seen the ladies that say, my father. I say, please go to your dad. Whisper to his ears, Dad, please tell me the truth. Do I have mouth odor? If he says yes, then come back to the clinic. Then we can investigate. I get it now. Okay, that's one part of it. Okay, what are the causes of mouth odor? Why mouth odor? You have what we call local causes and systemic causes. Local causes are things within the mouth. Okay, let's run quickly through them. Gum disease gives mouth odor. Gum disease gives mouth odor. Tooth decay gives mouth odor. Oral cancers give mouth odor. Oral abscesses. These are local things from the mouth. Abscesses, that is boils in the mouth, give mouth odor. Poor oral hygiene gives mouth odor. All within the mouth. Okay? Then the food we eat.
Okay.
Yeah, they are sulfur-containing food or sulfur-producing food substance. Okay. They give mouth odor. Well, there's this odor we have come to accept because of the health benefit of the thing. Garlic. People have come to accept because of the health benefits. But those days, if you eat garlic, people run away from you.
Run away.
But people know that it's beneficial, so they've come to accept it. Onions, they are sulfur-producing compound, they give what? Mouth odor.
Exactly.
Then alcohol.
All right, doctor.
Okay,
we're looking at
we can go and go.
Yes.
Okay.
So what do we do?
Then you have what we call the systemic causes.
Okay.
The systemic causes are things that are within your system. The paranasal sinus, those who have spaces here on our face, what we call the sinuses. Okay. So when there's sinusitis, it can give what? Mouth odor. Then when there are certain conditions in the abdomen, the systemic, GIT, cancer of the stomach give mouth odor. You know that something as simple as appendicitis give mouth odor. Respiratory tract infection give mouth odor. So what do? We
are there different odors? Yeah. They have different.
Some are peculiar.
Okay.
I just, before we talk about what we want to do, if if you don't talk for a while, by the time you open your mouth, there is odor.
Yes, those are local
what causes that?
Because the bacteria in your mouth, they are active. Okay. The food they ate, they are acting on it, breaking the food down. So if you don't talk for a while, you have mouth odor. Okay? Because as you are talking, the saliva is washing off the bacteria and the food and the debris.
We have just 2 minutes, and we still cannot finish because we still haven't talked about the importance of saliva. You know, you just mentioned saliva. It also has a very vital importance when it comes to oral health.
We call it cleanser. It's an auto cleanser. Auto cleanser. Okay? Right. Without it, your mouth can't be clean.
All right. So let's talk about keeping the mouth clean. The last time we talked about brushing twice a day. And we know so many people don't brush at night. Yeah. They're tired or they forget or all that. So what is the benefit of brushing your teeth twice? I need us to talk about that quickly, so that we can.
One of the ways you maintain a good oral health is maintaining a good oral hygiene. Okay. And you don't have to talk about oral hygiene, good oral hygiene without mouth cleansing. Well, I said either you are using the toothpaste, the modern toothpaste and toothbrush, or you use our traditional chewing stick. I know last time I said traditional chewing stick is still working. Yeah, we cannot do away with it.
Because it has fluoride.
It contains natural fluoride. Okay, so if you brush at any time of the day, try before going to bed at night. When you brush, you are not allowing the food debris to remain there for the bacteria to act on. Tooth decay is when bacteria act on refined carbohydrate that it produces acid that causes the tooth decay. So look at it this way. If the food debris is not there, the refined carbohydrate is not there, bacteria has nothing to act on, and there cannot be production of acid. So when you are brushing, to make sure that those things are not there. Bacteria is constant. Your teeth is constant in the mouth. Time is constant. The only that is not constant is what? The refined carbohydrate. Biscuit and coal.
Which is on our daily...
Yes, it's not constant. So once you can take it out by brushing, then there's no tooth decay. So we must brush before going to bed at night.
Could that be the reason why we have kids with so many plaques these days? You know, I see children...
Heavy plaque.
Because of the food, this carbohydrate you just talked about. All right.
As you are seeing those plaques, if you look closely, you see plenty decay. We have had children now. Those days, early childhood caries was very, very few. We only see it in books. But today we see it every day. Early childhood caries, any tooth decay between the age 0 and age 6 months and 71 months. Any tooth decay in the child's mouth. And now you say a child comes to the clinic with like 10 teeth decaying. 10. I'm not exaggerating. It was someone yesterday. 10 decaying.
That means they don't brush at all.
They brush. They consume a lot of refined carbohydrates.
Sugar,
juice. This so-called milkshake is actually starch plus sugar.
Oh goodness.
It's starch plus syrup. Don't start calling names. All this juice children take to school as lunch pack, they are doing more harm than good.
All right, doctor, we have to go. We have to go. I told you we can't really exhaust all the questions, but all the same, I think if you just visit your dentist regularly, I'm sure you get most of this information. Thank you so much for being a part of this. Thank you, doctor, for coming on the show today.
It's a pleasure. Thank you very much.
And we'll call on you again because I think we still need to talk.
Thank you so much for being a part of the show. Bye-bye from all of us in the studio.
Yeah.